Welcome to a new episode of Science in Context. I'm Sabine, and this week Dr. Ruth McCabe joins me to speak about the current Ebola outbreak. Ruth, what exactly is Ebola and how is this current outbreak different from previous outbreaks?
Ebola is a viral hemorrhagic fever that's spread through contact with infected bodily fluids, so things like blood, saliva, sweat, for example. So it can lead to quite serious symptoms that eventually progresses to organ failure quite quickly, as well as internal and external bleeding. Now, this outbreak is notable for two reasons. Firstly, the size that it was at the time when it was detected. So there was over 200 suspected cases and 60 deaths when we first learned about this on the 15th of May, and that's already quite large. We would expect to learn about this earlier. The second thing that's notable is that this is the Bundibugyo species of the virus, and there have only been 2 previous outbreaks recorded of this species.
And what is the role of mathematical modeling in the response?
So there's so many unknowns just now about this outbreak, and mathematical modelling is such an important tool to bring together the bits of information that we do know to help us get an idea of the things that we don't know. So for example, we can bring together what we know about deaths, for example, and then use that to get an idea of how big the outbreak size might actually be.
And you have recently published some of this work. How is that being used?
So it was really important to try and get an idea of how big this outbreak might already be at the time when it was detected. There's always a bit of underdetection in infectious diseases, but what our modelling allowed us to do was essentially provide insights into whether this outbreak might be hundreds of cases already, or whether it could be as big as 1,000 cases. And that's really important to know for planning the response.
Thank you so much for your time today.
Thank you.